Hi guys, so this is part 2 of my pre-op appointment for my gastric bypass. We're going to talk about vitamins and minerals, and hopefully I can get through this and this won't be 3 parts. Sorry. They want me to have my multivitamin, which I'm on pill form, but they want me to switch over to chewables, and I just didn't feel like spending any more unnecessary money today, so I will pick those up within the next week, or I'll at least get them ordered and get them here. Then they want me on calcium citrate, which I've been taking the Bariatric Advantage calcium chews. I love the raspberry. So I've been taking those. Then they want both a vitamin B12 and they want a B50 complex. You can take them in sublingual tablets, liquid drops, mouth spray, nasal gels, and my surgeon even offers B12 shots every 3 months. I don't like needles. No, thank you. Give me the pill. I was fortunate to find through Puritan's Pride, which is a vitamin company my dad has always ordered from. They have a vitamin B50 complex with a burst, it says, of B12. And they're sublingual drops. So, I don't have them with me. They must, I think they're in the living room. It gives you the little dropper. You put, you measure out your dosage. You stick it under your tongue for 30 seconds. It tastes like cherry NyQuil almost. And then you swallow it down. And they're not horrible, but they're not fabulous. But they're tolerable. Like I said, it's almost like a cherry Robitussin, like almost like a cough syrup. It's the same texture. And you just hold it under your tongue for 30 seconds and then swallow it down. My husband's even started taking it because he likes the way that he feels now that he's starting to take more supplements. They want me on an elemental iron, and I ordered, I think it's Bariatric Advantage, has chocolate raspberry chews. And I went with those. And I tried one, and it's almost like eating a square, thick Tootsie Roll. I mean, it's got the same kind of not creamy but not gritty texture, and the taste is almost the same. So, I mean, that's the best way I can describe that. Then they want me on my vitamin D, which I've been taking, and they cleared me to keep taking my little tiny gel caps for after surgery. And then now here's the thing. They want me on probiotics, and this is the first that I've heard of this. So when they mentioned what I need to have and how much I need to have, I was kind of like, what? Wait a minute. So it says in my paperwork that it's beneficial bacteria that maintain the natural balance of organisms called microflora in your intestines, and thus may help prevent constipation and have been shown to increase weight loss after bariatric surgery. And I guess my surgeon's in the process of releasing some new study that he was working on, I guess, on how it's beneficial, blah, blah, blah. So now he wants all his patients to take probiotics. And I really haven't done much research into it. But they wanted me to have 2.4 billion cultures. I mean, that sounds like enormously too many. That's like, what the hell is 24 billion cultures going to do for me? And they told me that it has to be in chewable form, that it can, or it can be a liquid, but it cannot be from just like yogurt. So we went to Super Supplements tonight, and my mom found, and I wish I had the bottle with me, these chewable ones. They're 1 billion cultures per tablet, and they're banana, and they taste like a banana Tums, and I actually could sit there and eat the whole bottle like candy and not think anything about it. But the problem is those ones that we picked up tonight are not sugar free. They have 1 gram of sugar in them, and when I talked to my dietitian about that, when I called her I called her from the store. She said that I could get those for now, but she warned me that because there's that 1 gram of sugar on there, that, oh, sorry, my computer's doing weird things. That because there's that 1 gram of sugar on there, that my body might not be able to tolerate that post-surgery, and that I would need to get a different form. She did recommend Bariatrics Advantage. I think they have strawberry. And she said that she's heard that they're not too terrible. They don't carry them at my surgeon's office. They do carry most of the Bariatric Advantage line, but they don't have the probiotics. So that's probably going to be something I'm going to look into ordering later on. So there's that. I wasn't too happy about that, because if they had told me about that, I would have had it ordered and ready to go, and I hate last minute. Oh, by the way. Speaking of last minute, oh, by the way. So we're going over what my paperwork is and my procedure, and my nutritionist, who is also my registered nurse on my case, tells me that I'm having the gastric bypass RNY, and I'm having a hiatal hernia repaired. And I went, what? And she repeated it, and I said, when did we discover this? And she said, oh, when you had your endoscopy. I had my endoscopy back in January, and this is the first time that anybody has mentioned this to me. And she swears up and down and sideways that Dr. McMahon has told me about this. And I told her, if somebody had told me I had a hernia, you would think you would know from like pain or something. And she said, you don't hurt? And I'm like, well, not that I've noticed. And she explained that a hiatal hernia is your stomach is coming up into your chest cavity. I didn't know I had this. You would think that's pretty big news. You would think that you would know that. So I guess I'm having a hernia repaired too, along with my RNY. Nobody told me until today. So sitting there with my mom in my pre-op appointment, they had 6 of us, or 5 of us in the room, and we did like a group signing of our paperwork. And so when I'm sitting there and I'm finding out that I have a hiatal hernia, which one of the other gals has too, it kind of caught me off guard. So anyway, the paperwork that they handed me for my follow-ups says that my stuff is automatically scheduled for me. I just need to work it into my schedule. But your 3-week post-op visit is on Tuesdays, 3 weeks after your surgery at 2 p.m. And that I need to arrive 15 minutes early for paperwork and vitals. And then I have a 100-day post-op. This appointment date and time is given to you in the hospital and is once a week and is held on Thursdays from 11 to 2. So for my my 100-day post-op on that Thursday, from 11 to 12, it says support group. 12 to 1, it says nutrition group. And 1 to 2 is medical follow-up. This is also the first that they've actually formally mentioned, and I didn't even ask questions about it, a support group. It's not a requirement like some of my friends have to do. Well, some of my friends have to attend a support group, and this is the first that it's been mentioned. But then again, I did advertise that, you know, I'm here on YouTube and on Facebook, so I do have sort of a support group if it's not in person. And then they said that at my 6-month medical follow-up, I'm going to have my labs done again, my blood work and all that. And then on my 9-month nutrition group, I guess that's my support group and everything, I have to come in and have what's called a DEXA scan, which is they want to scan my bones and see if I have like osteoporosis. So there's that, and I'm really wanting to hurry and get through this and quit boring you guys because I'm running out of time again. So don't need that. They gave me a prescription for a medication called Emend. and it's 40 milligrams, and it's 1 capsule, and I am supposed to take that 2 hours before surgery, and I guess it's supposed to help prevent nausea and vomiting, and they were telling me that it's something that they tend to give chemotherapy patients to help keep them from being nauseous and sick, and they have had study groups, and the patients that take this emend don't have after post-surgery nausea and vomiting, which I guess, hey, you know, I'll take one little pill if you can tell me I'm not going to throw up. So I have to get that filled. I will tell you guys now, if you ask for or are given this prescription for emend, I have found out from another patient that this is not typically something that your pharmacy will carry. They have to order this, especially at 40 milligrams. I guess they give cancer patients like 120 milligrams. So if you are on this, you're going to want to call ahead to your pharmacy and see if they have it, or give them the heads up that you have the prescription. Like I called my pharmacy today, and I told them I have this prescription. She said, well, I don't have it in that amount. And I said, well, I'm going to bring this in tomorrow. And she said, well, I'm going to go ahead and order it and get it here so that it's here for you. And she said, usually they make you bring in the paperwork and then they order it for you. But she said because my doctor put it into the system, that she can go ahead and order it without the actual written part of it. So just so you guys know. And I've also been told that not a lot of insurances cover this particular medication, and it can range anywhere from $20 to $60 for one pill. But you know what? If you can guarantee me I'm not going to be throwing up cranberry juice, not that that's what they're giving me, like I did when I had my nose done, not my nose done, my sinuses, I'd be willing to pay the $60 if you can tell me I'm not going to be puking all over the place. They gave me my discharge papers already, and then they gave me the information about the Hibiclens stuff that I have to buy. I have to take a shower with this Hibiclens. I have to scrub like from here down the night before surgery, and then I also have to do it before surgery, before I go in, to make sure I don't have any like heebie-jeebies, creepy crawlies, that sort of thing. I am spending my first night in the ICU because of my CPAP, and I have to take all that with me. Sorry, I itch. And in the ICU, she said I will probably be just on a, along the wall behind a curtain. And then later the next morning, when I'm done, quote, being monitored in ICU, they will move me to a private room. But they said in ICU, I can have 1 visitor. And then when I move to my room, I can have up to 5. So I kind of told my mom and my dad that I'm leaving it up to them if they want to be up there at the hospital with me when I have my surgery, because they're only going to be, I'm allowed 1 person to sit with me until I go back for surgery. So I didn't want them to come all the way out to Seattle to see me for 20 minutes and then, sit and wait for me to be out of surgery for however long it takes, and then have to take turns to see me. And then my dad does not like to drive in the dark because, they're getting older. So they would probably leave by 5. And I told my mom and dad, I'm like, I'm not even probably going to remember or know that you're there. So if you want to come up on Tuesday instead, when I've been moved to my other room and I'm up and walking and I know that you're there, then that's fine. So we'll see. But anyway, that is my information for my pre-op. And I think I have covered everything under the sun. And if I haven't, leave me questions. Look me up on Facebook under Changing Me For Me, or Changing Me For Me. Leave me comments below. Hit me up on Facebook. I'm always on Facebook. And I will talk to you guys later. I hope you enjoy the rest of your week.